Good evening. Welcome to Backstory with Joan Goldstein. I'm Joan Goldstein. Our topic this evening is the healthcare legislation. Is it spreading pain, benefits, or what is it doing? My guest today is Congressman Rush Holt. He's represents the Central New Jersey in the Congress since 1999. That would be what, 11 years now?
In my 12th year.
You're in your 12th year, wow.
Right.
That means you must have quite a track record. It turns out you do. Throughout New Jersey's 12th district, Rush Holt has developed a reputation for tireless advocacy for his constituents, and I have met some of them who tell me about it. He has assisted over 18,000 constituents who have contacted his office with inquiries, producing resolutions for problems ranging from Medicare to veterans' health care to mortgage assistance. In Congress, he's a leader on education reform, something I'm very interested in, open space protection, and science research and development. In fact, before becoming a congressman, you are a physicist?
That's right.
Right. That's quite an impressive background. Okay, let's have a look at...
Good to be with you, Joan. Thank you.
Thank you. Let's have a look and see what's been going on here. Back in March, the healthcare legislation was passed, and here's the Trenton Times newspaper item, Big Bill Spreads the Pain and the Benefits. And lives of the uninsured, businesses, upper income taxpayers, young adults, and seniors will be impacted as part of the 10-year, $940 billion legislation takes effect over time. Okay, since then there have been a lot of articles, a lot of talks, a lot of questions about what in fact this bill is going to do. Is it going to produce fairness? Is it going to produce quality of care? Is it going to make healthcare affordable or more affordable than it present is? We have some statistics that tell us that the U.S. healthcare is not doing such a great job. The longevity in the U.S. is ranked number 49. That's not very high up. And longevity referring to the length of time that people actually live, which is an indicator of their health or their health care, can be. As we look at a book written by T.R. Reid, The Healing of America, which is a cross-cultural study of how different countries have set up their healthcare system, we find that a lot of comparable economies, such as in Japan, Germany, France, and England, also have healthcare systems which seem to be less costly and seem to cover more people. In the first place, what makes them different is that the insurance companies are not for profit. They're not there to raise monies that might benefit their trustees. They're not for profit, so they're less costly. The second thing is that the doctors, in many cases, are paid salaries rather than fee for service. And the result is that they're not paid quite as much. They interview one doctor who says, "I know I will never be rich." But a doctor in the U.S. who I spoke to yesterday and said, "Well, if you've got anything you'd like me to raise when I speak to the congressman tomorrow." And they said, "Yes. What makes them think that a bunch of lawyers who know how to run a healthcare system, do they even know what's going on?" So there is a lot of tugs and pulls in many directions. No matter who you talk to, there's sectors of the society that are worried, that are frightened, that are confused. I took the initiative to ask some of my college students at the community college what they thought about this new healthcare system and what they would like it to be like. And I got some surprisingly varied
Before we get to that, could I'm not sure where you want me to start, but
would you like to start?
But you've put about 6 things out there already
Okay,
that
all
I'd like to comment on.
Good.
I mean,
Okay,
first of all, you held up the newspaper that says spreads the pain and the benefits.
Benefits, right.
I think people will find that this healthcare legislation alleviates the pain. It doesn't spread the pain.
Okay.
it does spread the benefits.
Okay.
In other words, health care benefits, in other words, insurance coverage, will be available to almost all Americans. And that is not spreading the pain, it is keeping people alive, because it is a fact. It is very clear from the data that without access, people die. I mean, it's the death rate among people who don't have good health care coverage, people who have lost their insurance, or who think they have insurance but are denied when things get tough. The morbidity, the mortality are greater. So by increasing access here, it will, just through that, make for a healthier America.
Can I
Yes.
ask a question in that respect? I've heard from some senior citizens that they hear that doctors are refusing patients under Medicare because they feel that the Medicare rates are cut even lower than they have been. I want you to have a chance to respond to that.
Well, that's still another point. I mean, you raised salaries, you raised whether this is run by lawyers. Let me get to some of those things. Let me finish the description of what this healthcare new law is and what it does.
Okay.
It takes the existing healthcare system in America and expands it so that essentially no one is left out, and makes each part of it work better. For example, for 2/3 of Americans who are covered with private insurance, often through their employer, it will apply some consumer protections to those insurance companies to make sure that they actually provide insurance. That it's not insurance in name only, which goes away if you start becoming expensive to the insurance company, or if you have a pre-existing condition, they'll find a way to drop you. It does away with those things. So for that group of people, it makes it better. For the next largest group of Americans, the 40 million people on Medicare, it makes it better because it will provide more coverage for prescription medicine, more preventive care, less runaround at the hospital where you get sent for redundant or even unnecessary or worse, dangerous procedures. As far as whether doctors are taking Medicare, Medicare is working in many ways quite well. 95% of doctors take Medicare. Yeah, it's true. Some doctors don't. Some doctors don't want to take insurance. They don't want to take Medicare. They want cash on the barrelhead. And they have a wealthy enough clientele, wealthy enough patient load that's what they can live quite comfortably, taking cash only for the work, the treatments they give. But for the most part, doctors take Medicare. But what this will do that will help a lot will bring in many more primary care physicians. Physicians who will look at the Medicare beneficiaries, and this will spread actually beyond just Medicare, but doctors who look at the Medicare beneficiaries as whole people, as patients, not as an object on whom a procedure is done. In other words, they won't look at this person and see a knee or a heart or an endocrine system. The primary care physicians will see the patient, and that will clearly improve the care, and not incidentally reduce costs. Because if what you do is go shopping around for specialists until you find somebody who can help you, that runs up a lot of expense for Medicare and doesn't make you, the Medicare beneficiary, healthier.
And it's a fragmented system too.
Yeah. Healthcare in America is fragmented, and this healthcare legislation is based on what exists in the United States. This does not remake it in the model of England or in the model of Canada or in the model of France or in the model of Germany. You mentioned T.R. Reid's book, and he looks at all those different countries, and they all work to some degree or another in different ways, and many of them work better than the American healthcare system. This will make the system we have, which is somewhat fragmented. We've got Medicare, we've got Medicaid, we've got self-insured small business people and independent contractors. We've got people who are insured through the big employers and so forth. This will make all of those things work better. Now, whether, you know, and that I hope puts to rest this claim that somehow this is socialism, that, you know, that what the president is doing is taking our health care out of our hands. No, this increases the choices that individuals, that small businesses, that companies have. It increases the choices. And as I say, it requires that insurance companies actually provide insurance and don't take a walk when things get tough, when and say, oh, we were with you when we were with you, but you know, you're costing us money now. And so this idea that it's run by lawyers, no, nonsense. I mean, right now, under Medicare or under your insurance policy from your employer, you go to your doctor. Your doctor and you make the medical decisions, not some lawyer, not some bureaucrat, unless your healthcare company, your health insurance company, has bureaucrats who will deny you coverage. That's what's happening. It's not lawyers in Washington who are denying you coverage. In fact, Medicare has a better record of paying doctors for the treatments given and for the work done than the insurance companies do. I mean, insurance companies, by the way, only spend about 78%, in other words, 78 cents on the dollar, actually providing health care. They collect $1 of premium from you and spend 78 cents actually providing health care. So where does the other 22 or 23 cents go? Well, marketing, overhead, profits, you know, dividends, and so forth. Medicare, on the other hand, spends about 98 cents out of every dollar actually providing health care. They don't do a lot of marketing. They certainly don't have to turn a profit. They have to break even, and for the moment they are breaking even and doing as well as the private insurance companies are, in fact, better.
And they have a long record of a high quality. Most people are very impressed with Medicare. So if that's socialized medicine, which it's not, you know, it simply means that the government's taking the initiative in this respect. It's a difference.
Now, you also mentioned doctors who are salaried.
Yes.
That has worked very well in a number of places around the country. The Intermountain and various healthcare systems, consortia of doctors and so forth. But this legislation doesn't require that. It is good. It seems to be cost effective, and the patients seem to get better care when doctors are salaried, because doctors will order a procedure only when the procedure is needed. There's no payment incentive that either subtly or overtly directs doctors toward one procedure or another. If they're salaried, there's nothing in the pay scale that distorts the system. So doctors make decisions solely on medical grounds. Now, most doctors do make decisions solely on medical grounds, but there are sometimes some subtle influences of the way the billing is done. In other words, you get paid for doing procedures, not for talking to the patient. So doctors find it hard to find the time to talk and listen to the patient because they don't get paid for that.
Right.
And now there will be, under Medicare, under the Medicare revisions in this bill, when I said there will be more primary care physicians, there will also be more reimbursement for listening to and talking with the patient. There will be, for example, without copays, starting this year, annual wellness visits, checkups, in other words, without copay. There are a number of improvements like that. You can have mammograms, prostate screening, various other preventive medicine without copays. And eventually, under this legislation, no insurance company in America, Medicare or otherwise, will be able to charge copays for preventive care.
Yeah, well, the preventive
So-
is key. It's absolutely key
Yeah.
because a lot of the health problems
Yeah.
turn out to be things that could be prevented.
Yeah.
Whether it's obesity and diabetes, and most common types of problems, prevention would be the way to go, and yet we don't have it.
Well, that's why in the big picture, what this health care bill does is bring almost everybody into the system, so that you don't go for months or years with your diabetes untreated, or your other problem lingering and festering until you have to go to the emergency room. So the people who have lost their insurance will now be covered, and you can get care before it becomes an emergency, before it becomes almost untreatable. And so people wonder, well, how can this be cost effective if you're bringing more people into the system?
Right.
Well, it's pretty expensive to run a system where the primary care is provided through the emergency room only when things get really bad. If the people are covered and they can get health care as they need it before things become a crisis,
Right.
they'll be happier, they'll be healthier, the society will be healthier, you'll have fewer missed work days and so forth. It's a real benefit to society, and it's cheaper.
That's an excellent point, especially because the emergency room is overused.
Yeah.
Because nobody knows where else to go.
Yeah.
But it's not an effective system for prevention. It's a stopgap situation, and they're overloaded, and too many people are using them because they have nowhere else to go, or they believe they have nowhere else to go. Yes.
So I did want to hear from some of your students. You had some
okay.
questions.
I think you'll find them. I find them so fascinating. Here's a fellow who says the healthcare in the United States today has the best equipment and doctors' money can buy, but that's just it. It worries me that healthcare is so expensive. Instead of worrying about the patient and trying to help them, healthcare employers and doctors are more worried about how something is going to pay for their procedures. Just what you said.
Yeah,
right?
I'd be repetitious if I address that. But basically, this will begin in Medicare right away. It will start shifting more toward treating the whole patient, less procedure-based medicine. For the rest of the country, people who have insurance and so forth, I think it'll be a slower transition to that more treatment of the whole patient.
Right.
But this legislation does move us in that direction.
That's great. He says there are people that are out there that are at risk of losing their lives, but can't be helped because their doctor is more concerned about affording their Mercedes. Well, he's a little okay. He says, now the second question I asked
we needn't disparage doctors.
No,
they're trying to help people.
Doctor helped me yesterday.
But the system is distorted. I mean, when payment is for procedures rather, for quantity rather than outcome, that distorts the system.
Yeah, it's what I call the tail that wags the dog. It's the incentive system. He says if it was up to me, healthcare would be in the hands of the government. You would make that happy. No more of these insurance companies exploiting their customers for their life savings just to get rid of a cold. I believe that if we had universal health care in America, things like the swine flu pandemic would not have occurred. And maybe the people who lost their lives from the flu would still be here, enjoying the little beauties this world has to offer.
Yeah. Now, he's I think, mixing up their universal coverage and single payer or government coverage. Because what this legislation does is move us almost all the way toward universal coverage. I mean, if you're an American, you can expect to have health care. That's why this is so historic. It's the first time in our history where we have now declared, if you're an American, you can expect to have health care. Now, how you get it might be through a variety of different ways. It might be Medicaid if you're very low income. It might be Medicare if you're elderly. It might be through your employer if you're employed. It might be through an exchange that allows you to buy insurance at group rates if you're a small business person or if you're self-employed. So if you work for if you're eligible for the VA, you might get it that way. But the point is, it is universal. Now, as far as what I think your student is referring to, single payer, the closest thing we have to that is Medicare. Medicare is a government single payer program, and it works. I mean, it does work. The health outcomes are really very good. They compare well with any place else in the world. If you're under 65, health outcomes don't compare very well with any place in the world. But if you have Medicare, and virtually everyone over 65 does, it works. It has low overhead, it's efficient. As I say, 95% of doctors take it. Sure, they'd like higher reimbursement. And under this healthcare legislation, there will be higher reimbursement, both for doctors who take Medicaid, but also for doctors who are primary care physicians and nurses, and healthcare providers of other sorts under Medicare, I beg your pardon.
Yeah.
So he's right that the evidence we have here in the United States is that a single-payer national program, Medicare, does work. Now, the criticism I can hear your viewers saying, yeah, but Medicare is going broke. Well, any healthcare system will go broke if there's 10% a year inflation, if the inflation is way above the inflation of the cost of living. That's true whether it's Aetna or Horizon or any healthcare company or Medicare. It's unsustainable. The difference is, in Medicare you can see the books. Aetna and Horizon won't show you their books. But in fact, they're not going to be able to maintain this. There's no business plan that they could show us that would keep them alive if there's 10% a year inflation in medical costs. So it's not Medicare's fault. Medicare actually does better than those private companies in keeping costs down and getting good outcomes.
Yeah, I think I saw some statistics that in America, the senior citizens were in better health than any other age segment, and that has to do with Medicare, the fact that they have so much this available to
in
them,
part. In part. I mean, there. When you talked about longevity earlier,
Right.
There are probably a number of reasons why Americans don't live as long, and it's not just because of the healthcare system.
No.
It's there are bad habits.
Right.
Bad eating habits, less exercise than Norwegians or other people, but part of it, and this was my earlier comment, comes because of access to health care. If you have access to health care, you will live better and you will live longer.
And because I'm interested, the business of getting more doctors in primary care is a wonderful idea. But according to Reed, in these other countries, the medical students don't pay for their very expensive medical education. And over there, they pay for it. So therefore, that's an incentive for people to go in that direction. Are there any thoughts or plans about how do you encourage people to go into primary care medicine?
In fact, this legislation, and it begins, let's see, beginning fiscal year 2011. So that will be this fall.
Very soon.
There will be increased payments, both in dollar amount and number of scholarships for doctors, medical students, and nursing students who want to go into primary care. Furthermore, the reimbursement rate for those in primary care under Medicare and Medicaid will get a bump up right away, and will be on a faster annual growth rate. So that will help. And also students who want to go into working in clinics that are serving the underserved publics, they will get scholarship help. It's not quite the same as other countries, I'm sorry to say, where they would pay for all expenses of medical study. But this will go a long way. Right now, today, it's not unusual to end up with $100,000 or $200,000 in debt.
That's right.
After your medical study.
So therefore,
and
there's
so some doctors say, "Oh, I got to pay that off quickly.
Right.
Therefore,
Yeah.
I'll take a lucrative job, dermatology. I don't know, whatever it is.
Whatever that can bring in the most. Yeah.
And
for the wrong reasons.
but this legislation, this new law, will help significantly in that.
That's great. That's wonderful. I seem to recall there were times when you could get scholarships into these fields, and you had to do payback, which meant you had
through
to
the Public Health Service, you can do that.
Yeah.
Of course, the military will pay you for medical to go to medical school.
Yeah, because I had that. I remember I got a postdoctoral fellowship, and from I think it was the National Institute of Mental Health, and I had to do something to pay it back, and I served on the State Public Health Council of New Jersey for something like 10 years. So that was my way of paying back. I think we're going to have to wrap it up. I think you and I could go on talking about this for the next 10 hours. You are probably the most dynamic and most well-informed person I've talked to on this subject.
There's a lot in this legislation, and I'm excited about it. It's historic.
I can
tell. In 1935, to be old, on average, was to be destitute. Social Security changed that.
Right.
In 1965, to be old, on average, meant you got substandard, really poor health care, unless you knew a doctor who would give you charity and whatever.
Right.
Medicare changed that.
Yeah.
So it said if you're a senior in the United States, you can expect to have health care coverage. What this does brings that to everybody. If you're an American, you can expect to have health care coverage, whatever your age, whatever your income, whatever your ability to pay. This legislation will help you pay for the insurance if you have trouble paying for it. If you can afford to pay for it, no more than, say, 10% of your income, then you're expected to pay for it. But the point is, everybody will be covered. It's nearly universal. There are lots of things that I'd like to have a little better. I'd like to have more community health centers and this and that.
Yes.
But
I would go with that
there's
too.
a lot in here.
Yeah.
There's a lot in this new law.
You've done a beautiful job of explaining what everybody's been scrambling all over the place. A lot of misperceptions. And thank you, Congressman Rushholt. You are really a very brilliant, well-informed person. And I want to just announce that for my next show, I'm going to do it on energy and the environment. I, as you can see, wrote a book a long time ago called The Politics of Offshore Oil. And I'm going to have a guest who wants to explore with me how the environment is being affected by our energy recovery system.
I wish I could come back for that. I'd like this book is going to have to go into a new printing because
I think so too.
I think it's
you
timely.
know what? The invitation stands. You could come back for that. Thank you so much for coming to view Backstory with Joan Goldstein. Good evening.